Welcome to the part 2 of the pharmacotherapy of type 2 diabetes mellitus. Dear students, I will be discussing the pharmacology of metformin first because metformin is the first line drug for the treatment of type 2 diabetes mellitus. Metformin is an oral anti-diabetic. It is available in the form of tablets, film-coated tablets, as well as controlled release, prolonged release, and extended release tablets. Metformin is a biguanide, and biguanides are oral anti-diabetics which are useful in type 2 diabetics. They overcome insulin resistance. Fenformin is the other biguanide which is not used because of increased incidence of lactic acidosis. And metformin happens to be the first line drug in the treatment of type 2 diabetes mellitus. Metformin does not enhance insulin secretion, but please note, presence of insulin is required for metformin to produce its action. Since metformin does not increase insulin secretion, hypoglycemia is very rare, seen only with large doses of metformin. Hence, we classify metformin as a euglycemic drug rather than a hypoglycemic agent. Now, presence of insulin is mandatory for the drug to act. Metformin is not useful in type 1 diabetes mellitus, and even in type 2 diabetics, sometimes you may not get the response to metformin because in those patients, insulin levels would have been very low. How does metformin act? How does it overcome insulin resistance? How does it reduce plasma glucose levels? Metformin activates AMP dependent protein kinase AMPK, which seems to mediate the actions of metformin. The principal action of metformin is to interfere with the hepatic output of glucose by interfering with gluconeogenesis. The second important mechanism is it enhances insulin mediated uptake of glucose, and hence it overcomes insulin resistance. This is possible because metformin increases the expression and translocation of GLUT1 from the cytoplasm to the cell membrane. This is how metformin overcomes insulin resistance. Metformin also enhances anaerobic glycolysis by interfering with the respiratory chain in the mitochondria. A minor action of metformin happens to be that it interferes with the absorption of hexoses and amino acids from the small intestine. Hence, metformin reduces plasma glucose levels and also helps in overcoming insulin resistance. The pharmacokinetics of metformin. It has a half-life of 1.5 to 3 hours. It acts for a duration of 6 to 8 hours. The daily dose of metformin required ranges from 500 milligrams to 2.5 grams, which is given in 2 to 3 divided doses every day. Metformin is not at all metabolized. It is excreted unchanged by the kidneys. So in renal failure, metformin can accumulate and this can give rise to lactic acidosis. Metformin can produce adverse effects frequently, but rarely they are serious. Gastrointestinal adverse effects like nausea, anorexia, metallic taste, abdominal bloating, mild diarrhea, which reduce with frequent use of metformin. Vitamin B12 deficiency can be seen because of reduced absorption from the small intestine, and it is seen when metformin is administered in larger doses. Lactic acidosis is rare. The incidence is less than 1 per 10,000 patient years. The contraindications of metformin is this given list because in all these conditions there can be increased chances of lactic acidosis, severe renal insufficiency, severe liver diseases, severe respiratory diseases, alcoholics, hypertensive states, and congestive heart failure. These are the conditions where the chances of lactic acidosis increases a lot. Hence, metformin should be avoided in these situations. Why is metformin the first line drug in type 2 diabetes? What are the advantages of metformin? Number one, hypoglycemia is rare. Metformin is called a euglycemic drug rather than hypoglycemic drug. Hypoglycemia is rare because metformin does not enhance the release of insulin. So this can have a lot of advantages for the patient. Safety is enhanced with metformin. 2. Metformin can induce weight loss, and this becomes even more important in type 2 diabetes because obesity is a central feature in type 2 diabetics which directly contributes to insulin resistance and hence the pathogenesis of type 2 diabetes mellitus. Weight loss is enhanced by metformin because it produces anorexia. Number 3, metformin significantly prevents not only microvascular but also macrovascular complications of diabetes because not only it reduces plasma glucose levels, which is responsible for significantly preventing microvascular complications, metformin also overcomes insulin resistance because of which it significantly prevents macrovascular complications also. This is in contrast with insulin. Insulin, when it is administered, can significantly prevent only microvascular complications but not macrovascular complications because insulin just reduces plasma glucose levels. Insulin cannot reverse its own resistance. Number 4, metformin's efficacy is excellent. There is a 0.8 to 1.2% reduction in glycosylated hemoglobin levels with metformin, and this is par excellence for any anti-diabetic agent. Number 5, metformin retards beta cell failure because it has the ability to preserve beta cell health. This is in contrast to classes of drugs. For example, sulfonylureas. Sulfonylureas enhance insulin secretion. They are also used in the treatment of type 2 diabetes. They are also oral antidiabetics, but they accelerate beta cell failure because they promote beta cell apoptosis. In this regard, metformin is much more safer because it preserves beta cell health. Number 6, metformin can be used along with any other anti-diabetic which is given orally or which is injected. This is in contrast to, say, an agent like pioglitazone, which is the thiazolidinedione. Pioglitazone cannot be given along with insulin, but metformin can be given with insulin or any other anti-diabetic. Number 7, metformin has been seen to prevent new onset type 2 diabetes mellitus in pre-diabetics, especially if they are middle-aged and obese. These are the 7 advantages with metformin because of which it is used as a first line drug in the treatment of diabetes mellitus. Unless metformin is contraindicated, unless metformin is not tolerated well, metformin happens to be used as the first line drug. Apart from diabetes mellitus, metformin is also used in the treatment of polycystic ovarian disease. Here, metformin improves ovulation and hence fertility, probably because it helps in overcoming insulin resistance and also reduces the levels of insulin in these patients. Thank you. In the next presentation, we shall learn the pharmacology of sulfonylureas.